Hi everybody, it's Adam, the geneticist and genomic data scientist from Verdure Healthcare. So today it's time for our next episode in the NiPT question and answers. Alright, so as you might have all known already that I am actually a participating consultant at the Nuffield Council on Bioethics. So bioethics is actually also known as medical ethics. So I'm a participating consultant on answering questions about the non-invasive prenatal testing, or known as the NiPT. So if you're interested, please go to www.nutfield.org/blog/NiPT-private. So this is an article about some general information on the NiPT test and then what are some of the concerns that people have. So when you scroll down to the bottom, you'll be able to see questions. So that is why I'm opening this Facebook Premiere today, and I will be talking about some of the questions and answers that people have in the UK about the NiPT. So last time I've answered one of the questions, and now this is one of the best questions I would love to do a topic on today. So this lady, Isabella Sinnerud, okay, so she's saying that, hi, I'm 39, second pregnancy, and my NiPT test detected increased risk for XXX, bracket 47, XXX at 12 weeks. I have never heard about it. My doctor said these tests are 99% accurate. 3 days after finding out about it, I met with general counselor who put some numbers through some program in the computer and said that there are 74% chances that the NiPT test result for trisomy X is false positive. However, for comparison, she mentioned that the result for trisomy 21 would be 90% positive if detected during NiPT testing. I scheduled amnio in 3 weeks as I want to be certain. My obgyn said I should not have high hopes, but the genetic counselor calculations show a contradictory opinion. Can anyone share their experiences for XXX syndrome detected at NiPT? Wow, okay, so this is a question full of doubts, full of contradiction, full of worries and confusion. Now you might not understand the question all in one go. If you have that problem, please do watch it again. So please do watch just now when I read out the problems to you. Alright, so I've answered her question and it was quite long. So my name on there is Adam Geneticist, okay? So it takes me around 2 slides to fit my answers into her question, okay? Because there was so many confusion, I have to back up my answers with scientific resolutions and research, and that hence the long answers. But don't worry, so today the success tip for today is to break things down. First of all, what is XXX syndrome? How can an NiPT test detect XXX syndrome? Number 3, why NiPT test is more accurate? What should an NiPT test include? Now this is extremely important. Number 4, putting some numbers through a computer program. Will they generate anything useful at all? And number 5, can a general counselor analyze an NiPT report? What qualification should a genetic specialist or genetic counselors have? Alright, so these are the 5 main questions that I will help answer today. So first of all, what is XXX syndrome? Now, you might remember from my previous talk that everyone should have 23 pairs of chromosome and 46, okay? So that means 46 pieces of chromosome. In pairs, that would be 23. Okay, so from the first pair until the 22nd pair, they are called the autosomes. And these are the normal chromosomes. But when you come to the very last pair, okay, it's called the sex chromosome, whereby if you have an X and another X like this, you would be a female. If you don't have this X over here, instead you have one X and one Y, whereby the Y chromosome would be shorter than the X, you are a male. Okay, so that is the very fundamental concept that you need to understand the rest of the talk today. All right, based on this, okay, we're using female set of chromosome as an example, whereby triple X syndrome means instead of having a normal 2 X chromosome, now this baby girl here would have 3, okay, and that's not normal. But, okay, so what does that imply? What is the overall effect? In fact, sometimes, a lot of times where triple X syndrome is unobvious, okay? But the thing we know is that this is definitely a female, a baby girl, female, all right? So usually she will be taller than average, okay? And the thing is that there are no unusual characteristics or physical appearances. All right. In some more serious extent, there would be an increase of learning disability, delayed developmental skills, speech and language skills. Sometimes, if more serious extents, there will be weaker muscle tone. Sometimes there would also be behavioral and emotional difficulties. So that is why if you are the first generation who got this particular disease, it is very hard to tell. In fact, at Verdure Healthcare, a week ago, we have received a client whereby she has triple X syndrome. She was completely normal. Her menstrual cycles don't show anything abnormal at all. Otherwise, she would have known. However, though, she was married for 8 years. She tried to have a baby, but obviously failed to do so. So that's why she and her husband came to us. And I have organized another test for her. It's called the pre-pregnancy DNA screening. Now that's another whole different test altogether. If you're interested in learning more about that test, I would strongly suggest you to look out for my next Facebook Premier session where I'll be talking about chromosomes and that test, whereby we use this pre-pregnancy DNA test to screen the parents, all right, parents' genes and chromosome so that they won't inherit anything bad to their offsprings or their future child. Now, if you are having a child with a triple X syndrome, it is considered as something less serious compared to other diseases such as the Down syndrome, whereby, let's go back to the previous slide, whereby on the 21st pair of chromosome, there is an extra piece. So, I mean, a lot of you might have heard of Down syndrome before, whereby the most obvious characteristic would be intellectual disability. All right, but for triple X syndrome, this is often not the case. So that is why if let's say this mother who has triple X syndrome, she doesn't feel anything at all, there's nothing physically wrong with her, she goes ahead and gets pregnant naturally, but the next generation inherited this triple X syndrome from the mother, only then in the next generation there will be some problems such as behavioral and emotional difficulties, delayed motor speech, weak muscle tone, all that happening. And remember, friends, genetic diseases, if you are the first generation, you might not have such a serious symptom. But for the next generation and after that, they will only have an earlier onset, meaning to say that the symptoms would come out earlier and a more serious symptom. All right, so this is something that you have to remember. Okay, so regarding that, if let's say, okay, touch wood, if you have tested a positive for triple X syndrome, especially in the baby, should you continue the pregnancy? Well, I would say that you can also consider getting yourself tested first. If let's say you are the first generation who got the triple X syndrome, then you might want to really take it into a serious look, and you need to be prepared that, okay, the next generation, which is your child, they might have a more serious symptom. But if after you've got yourself tested and there's nothing wrong with you, then obviously the next generation who's got the triple X syndrome will not show such a serious symptom. At least that is true for most of the cases. Okay, so why an NiPT test is more accurate, and what should an NiPT test include? Now, at Verdure Healthcare, first of all, we would need to check whether or not this baby has Down syndrome, Edwards syndrome, or Patel syndrome. Okay, so as mentioned before, Down syndrome, the most obvious characteristic will be intellectual disability, and some of them might have congenital heart diseases, but Edwards syndrome and Patel syndrome are very serious genetic diseases. So serious it might even cause discomfort for some audiences. All right. Part 2, besides that, we will also check part 2 for sex, chromosome, and aneuploidy. All right, meaning to say that, for example, for guys, you have an X chromosome and a Y chromosome, but there are symptoms such as XXY chromosome, all right, or XYY chromosome. And obviously, just now, this is the whole topic that we talked about, XXX syndrome and even Turner syndrome XO, meaning to say that on the exact opposite effect, instead of having one extra X chromosome, now you have one less X chromosome. Okay. Now, also in part 3, we will check 84 kinds of genetic diseases that are most commonly happening in Asia. All right, and very often, okay, majority of the clinics, they will only include this and this, part 1 and part 2. But at Verdure Healthcare, on the part 3, we will check, this is called the microdeletions, whereby it is the very small genetic defects or mutation inside the chromosome. Because a chromosome is in fact a pack of DNA. So it is very difficult to tell a very small change or small mutation by just looking at the chromosome like we have just now. And we have to look into those chromosomes, only then we know if there are specific diseases such as alpha thalassemia, Crichton-Cat syndrome, and all these kinds. And so with us, the NiPT test, we will check the rest of the chromosome that we have not done so over here. Because out of the 23 chromosome, this is a sex chromosome, and 21, 18, and 13. So there are the rest that we will be checking as well. And this category will fall under the incidental findings. Okay? Right, so this is exactly the picture of what will be appearing in the report. So we are looking at every single piece of the chromosome. And for example, if let's say there are some itsy bitsy pieces missing inside the chromosome, we have to use a very high technology called the next generation sequencing in order to be able to show that. Okay, and those are called microdeletions. Alright, so this is a sample of Down syndrome, whereby you can see on the 21st pair of the chromosome, you get an extra piece. Alright, so Edwards syndrome on the 18th pair, you get an extra piece, and Patel syndrome on the 13th pair, you get an extra piece. Okay, so let's have a look at the risk of getting these diseases. So you might not be able to see this graph, the details clearly, but anyway, this is the percentage or the risks, and this is the maternal age. And this is over here, 20 years old, the pregnant mother, 20 years old, and then on the extreme end would be 49 years old. So this is 30-year-old, okay? This is the mark, a very important mark, because as you can see that the risk line, whether it's blue or red, is not increased at all before the age of 30. But, okay, let's have a look at this extreme end here, 49 years old. In a group of pregnant ladies, 49 years old, okay, so this red line signifies the chances of getting a baby with one of the three diseases, Down syndrome, Patella Edward, is 1 in 8 babies. Okay, that is more than 10%. That's very high, and majority of parents will not be able to accept this risk. Okay, but if we look at only Down syndrome, okay, which is symbolized by this blue line over here, within a group of 49-year-old mothers, okay, 1 in 11 babies would be getting Down syndrome. Okay, so that's about 9%, and still that is very high as well. Okay. And most importantly, through the analysis of the chromosome, we will be able to tell the baby's gender. All right, so that's what the test on sex chromosome and ploidies are for. So let's go into a detail a little bit. All right, so we know about XXX syndrome or triple X syndrome, like what we have talked about just now. For guys, if you have an X and an extra piece of X chromosome and a Y chromosome, this is called Klinefelter syndrome. So Klinefelter syndrome, the most obvious characteristic would be sexual immaturity. For example, this particular male cannot produce sperm cells and would be more feminine in appearance, for example, like breast swelling, all right, enlargement of the breasts. Okay, and Jacob syndrome, of course, the characteristic is less severe than Klinefelter syndrome, but this guy over here, he has got an extra Y chromosome. And the only characteristic that might be a little bit abnormal would be the tallness. Okay, so this particular male here would be a bit taller than average. And for other characteristics, it hasn't been documented by science whether they would show other really special features or not. Okay, for Turner syndrome X0, whereby there is one chromosome being missing, then this will be a more obvious kind of symptom. For example, short stature, webbed neck, and sexual underdevelopment. Okay, whereby the ovaries or even the most superficial reproductive organs might not develop at all. Okay, so as you can see, even within sex chromosome aneuploidy, there are different levels of severity. So for example, if let's say touch wood, okay, I really don't want anybody to get this, but for Jacob syndrome and triple X syndrome, pretty much, okay, you don't have to really stop the pregnancy. But of course, this is everyone's opinion. If you think that just because there is one chromosomal abnormality that you prefer to stop the pregnancy, we will respect your decisions very much. But anyway, if you ask us for our opinion, we would say that these diseases, they don't really affect the quality of life, I should say, then there is really no need to stop the pregnancy. But if it's Klinefelter syndrome or Turner syndrome, then there might be a need to consider stopping the pregnancy, because the most obvious quality or aspect of the quality of life being affected will be fertility, all right, and also some physical appearances as well. So, and this is the microdeletions, whereby I've got a chart here to clearly tell you what it is. So imagine this is the chromosome, but there is just a very small part being missing or deleted genetic material over here. And as a result, even though that the chromosome appears a bit shorter, you still can't tell using the chromosomal analysis, or in the science terms called the karyotyping. And that is why we need to have a very specialized machine to actually pick these diseases out. And we do pick each diseases one by one, such as the George syndrome, alpha thalassemia, and also Wilson's disease. All right, so how does NiPT work? Okay, you see, NiPT detects and tests for your baby's DNA. Okay, it's not a blood test, it's not a test to measure the hormones, it's not a test to measure the nuchal tubes behind the baby's neck to determine whether or not there is risk for Down syndrome. No, it is a DNA test, and that is why the test result can be as accurate as 99.9%. Okay, it depends on the local laws and regulations in order to see how much can you write your test as accurate as. Anyway, so, okay, during the 10th week of pregnancy, we will take around 10 milliliters of maternal blood from the mother, okay, just from the mother around the arm over here using these blood vessels, and we will be able to pick out the baby's DNA. And why? Why is that so? Okay, when you get pregnant, okay, you would be transporting the nutrients and having some exchange with the baby via the placenta and the umbilical cord. Okay, so the baby's waste product will also be, transported this way, and then maternally, when you eat something, the nutrients will go through the placenta and to the umbilical cord. So there will be such exchange going on. All right, and hence there will be some tracks of the baby's DNA being left over in the mother's blood. And when we take 10 milliliters of it, we only need to see at least 5% of that will be the baby's DNA, and that will be enough for us to proceed with the NiPT test. All right, so compared to the older generations technology, the amniocentesis, sorry. All right, so whereby the mother lies down and the doctor using the ultrasound equipment to detect an area like this in order to get the needle down and take the amniotic fluid. All right, and this is quite a goosebump causing kind of action, because when the baby moves, chances are the baby will hit the needle. All right, so this is not a test to be done just on out of nothing at all basis. When we have, for example, NiPT test showing high risk for Down syndrome as an example, only then we will strongly suggest the parents to check their amnio using this technology. Otherwise, if the NiPT test says normal, low risk, okay, then we will trust the NiPT test. Okay, so now here's the next part. Putting some numbers through a computer. Will they generate anything useful at all? Now let's have a look at this part of the question again. 3 days later, after finding out about it, I met with the general counselor, all right, who put some numbers through some programs in the computer and say that there are 74% chances that the NiPT test result for trisomy X is false positive. All right, let's dissect this down. What is false positive? Now, false positive is that, okay, if let's say the NiPT test say you have triple X syndrome, what are the chances of this result being wrong, whereby you don't have triple X? That is called false positive, chances of false positive. Okay, the thing is that when NiPT tests are 99% accurate, then the chances of getting a false positive result is 1%. Okay, that is very simple mathematics. Okay, anyway, honestly, I'm quite surprised that even in the UK, there has been such confusion going on. But anyway, when this general counselor putting some numbers, honestly, we don't know what numbers are those, through some program in the computer. Now, the thing is that, okay, even if you put, okay, the statistical calculations that are appearing in the NiPT report, the computer program, or honestly nothing in the computer world, can tell you about the false positive result for this specific NiPT report. So this is something that we have to get clear so that you won't be cheated if you are looking for if you are at the genetic counselor's place. And furthermore, when you have the NiPT report, you should not be consulting a general counselor. Why? Okay, that will lead to the next question. Can a general counselor analyze an NiPT report? Okay, let's stop there for a moment. Let's answer the first question with one simple word. No. Why? Okay, what qualifications should a genetic specialist have? Right, genetic specialist is a broad term whereby you can be a geneticist or you can be a genetic counselor. Now, genetic counselor is in fact a specialized counselor in analyzing genetics report. Okay, a geneticist is a person who can also, for example, order a specific kind of genetic test and also diagnose the problem in a patient or client. Okay. And they can even do some preventive measure such as the pre-pregnancy DNA test like what we are doing here in Verdure Healthcare. So for me, I am a geneticist, okay, and I also do the role of genetic counselor. Okay, right, anyway, so I've shown you over here a sample of the genetic counselor app. Without further evidence, I couldn't say that they are not useful, but the thing is you need to get face-to-face or at least, an online consultation with the genetic counselor instead of, just looking at some kind of information that these apps can produce. Okay, so let's talk about what kind of qualifications should a genetic counselor or geneticist have. So for me, although I'm not a doctor, but I am a medical scientist. So for me, I have the Tsinghua University professional qualification in histology to study the tissue structures in the human. And next, I also have that pathology certification, where pathology is the study of the origin of sickness or illnesses. Furthermore, I have continued my education at Beijing University in pathophysiology. Pathophysiology looks at what are the effects of this disease have on the body. And I'm also qualified by the Royal College of Surgeons of England by receiving their postgraduate certificate in surgery. All right, so I'm qualified as a surgical instructor, and although I don't teach surgeries anymore, but I am focused in genetics. But okay, do you think that is enough for me to talk to you about genetics? Absolutely not, because if you want to talk about genetics, you have to have the specific qualifications like this, and it has to be done by a university's School of Medicine and their Department of Genetics. Okay, if your School of Medicine does not have a separate department for genetics, that school itself might not even be qualified to open any courses on genetics, at least not a standalone qualification. Okay, so I have earned the Stanford Genetics and Genomics Certificate from the Stanford University based in the US. Alright, so why? Because they are very proud of their qualification, Stanford Genetics and Genomics, because this university has done a lot of research on that. Okay. Anyway, well, when we follow the US system, the US is getting even more strict on offering genetic tests, and they have quite a bit of expectation on genetics counselor. So if you want to offer anybody any kind of genetic test, besides getting a qualification as either a geneticist or genetic counselor, you have to be further qualified, okay? And for me, I have continued my studies in genetics with Harvard Medical School on specifically genetic testing and sequencing technology. Alright, sequencing technology is a technology to look at very small genetic mutations within the chromosome. Okay, And those test results would come up as a bunch of genomic data. And I'm also qualified as a genomic data scientist by the Johns Hopkins University using the computer programs to organize the genomic data, make those into a useful report so that we can do some useful analysis. Alright, so as you can see, it does actually take quite a lot to become a geneticist or genetic counselor. So if you're not qualified this way, I am really sorry, but you are not really qualified to talk about genetic tests. Furthermore, even if you have all these qualifications, okay, you still need to have third-party recognition for whatever that you're doing with the genetic test. So for us, we have been recognized by the American Society for Reproductive Medicine, because you have to be trained in reproductive medicine in order to provide genetic tests specifically for pregnancy or pregnancy preparation. Okay? And this membership is renewed on a yearly basis. Anyway, so with Verdure Healthcare, our NiPT test is being done by DNA Lab, okay? And they have been in Malaysia for a very long time. They are working with UKM, okay, University Kebangsaan Malaysia, and they are in the science part of UKM. And over the years, they have been receiving many accreditations and awards. So with us, Verdure Healthcare, we have been in this industry for 18 years already. And because of our service quality, our honesty, we have won, okay, the Reader's Choice Award 2021, and this award has been given by one of the most famous parenting and pregnancy magazine called Baby Talk Mama Papa. Alright, so thank you very much everybody for your kind support, because without your trust, this is not going to happen, okay? And furthermore, after a very tiring and stringent process, okay, we have achieved the Superbrand Status. Superbrand Status 2021, and within the judging panel, as far as I have understood, there are 3,000 judges in there. Okay, so if you want to know further more about how we got this kind of award status, you can go to our Facebook page, Verdure Healthcare Consultancy, and there will be some further information about what exactly is a super brand. So we hope that with all these qualifications and awards, we can earn your trust in helping you to do this very important test of NiPT. Alright, so if you are currently thinking about getting pregnant, preparing for pregnancy, or if you have already gotten pregnant, okay, whether it is before 10 weeks, right on 10 weeks, or it's already a bit later than that, you are most welcome, and we would love to hear from you. So please give us a call at this hotline, and our healthcare services relationship manager will be able to answer the questions that you have in mind, and we would love to hear from you. So until then, in the next time, we will talk about the pre-pregnancy DNA test and also chromosome 11. So this video will be put on YouTube. Kindly subscribe, share our videos, and that will be the greatest support to us. Thank you so much once again, and I will see you next time.